Hello everyone, welcome back to Clinical Cousins YouTube channel, where today we're going to discuss some really important concepts that'll make us better providers of care. So sometimes we forget while we're studying that we're going to be using this information to save lives. So with that in mind, let's discuss total peripheral resistance. This can sometimes be a confusing concept for people, but it's abbreviated TPR, and this is basically just a fancy word that we use to describe the total or combined amount of constriction that our arterioles are giving us. So TPR is actually closely associated with our diastolic blood pressure, that bottom number. But what is resistance in the first place? What is total peripheral resistance if we don't even know what resistance is? Well, how do we determine it? Well, the scientific way of going about this is using, and forgive my pronunciation, the Poiseuille equation. So this equation basically states that 8 times the length and viscosity over pi times radius to the fourth. So if you're like me, you're like, what the heck does this even mean? Well, the significance of this equation is that we can reduce our patient's blood flow from one point to another. If we make the blood really thick, it's going to have more resistance. If we make the blood vessels long, it's going to have more resistance. It's going to be harder to move from one place to another. If we clamp down that vessel in the middle, it's going to be extremely hard. The resistance is going to go up a lot. Now, the most important and effective way to decrease blood flow from one area to another, to make it harder, is by reducing the diameter, by clamping down the vessels in the middle with alpha 1 receptor agonists. So, for example, if you found out that your patient had a carotid artery that was 80% occluded, you might think before this lecture at least they have 20% of their blood flow going through, but this is actually wrong. A patient with a carotid artery stenosis of 80% actually has their flow reduced to the 4th power. So this is a serious blockage. This is probably over, I think, like 200 times reduced. So this is a serious block, and it's essentially a blocked artery. So you can see that if all of the arterioles are dilated, you can say that there's low total peripheral resistance. This is a good thing. Blood flow is moving from one area to another. Now, high TPR, if we constricted those vessels, remember the most important way is by alpha 1 clamps, then we can see that our patient would have a high TPR. So now we're going to talk about a concept that confused me for the longest time, and I'm talking about series and parallel arrangements of blood vessels as they relate to resistance. So blood vessels in a series are lined up one after the other. Think of like a Netflix show series. There's one episode after the other. Now, this means that blood flows from one vessel to the other and to the next until it reaches the end. And blood vessels that are in a parallel arrangement, actually, they come from the same source, and then all of the flow will be happening in all the vessels at the same time. So when blood vessels are in a series, the total resistance can be calculated just how you would think, by adding up the resistances of all the vessels. So if we were to increase one resistance, if we're going to clamp it down, then the total resistance would also be increased. This is not a really complex concept to understand. Now, here's the tricky part though. When blood runs through vessels that are in a parallel arrangement, the total resistance actually decreases when a resistance is added. And if you're like me, you're going to be like, what the heck? I don't even understand that. Well, let me explain what I mean. Imagine that all the blood in the aorta is like a big bucket. Remember, all of our cardiac output is in the aorta. Let's say that this is just a big bucket, and that all of the different arteries are like smaller buckets. And then all of these arteries will eventually end up into a big vena cava bucket at the bottom. Well, the arteries are an example of parallel arrangements because they are receiving blood from the same source. So all this blood right here from this big bucket, they're going to flow through the arteries at the same time. So let's think about this. We have our, say, cerebral, coronary, skeletal, GI, renal, our cutaneous arteries. We have all of these arteries. And if we were to add all of the diameter of these arteries, we can see that we can think of it as one big vessel, as one big diameter. So all the diameters, we're going to add them up. We're going to think of it as one big vessel. So think about it. If we were to add another form of resistance, another vessel, let's say that we add another artery that just opened up. Well, we can see that the diameter of the larger vessel would actually just get bigger. We just added this diameter to this, so we're going to make this one even bigger. So we can see that the resistance, the amount of clamping, is actually decreased. So an example of this is if we were to hang a bag of fluids for our patient and we run it through just one IV, say it's about this wide, it's going to run pretty good. But imagine that we've started 10 IVs in our patients. That IV bag is going to drain super fast because essentially we turn cocktail straw into a big milkshake straw. This is because by adding more sources of resistance, more IV tubes, more arteries, we are actually decreasing the total resistance. So you see we added a resistance, but it actually decreases the total resistance. So this brings us to our next important concept. We're talking about laminar versus turbulent flow. This is laminar straight flow versus chaotic turbulent flow. So these are both based on the concept of Reynolds number. So if you're in physics, if you're studying physiology, you might have to know this, but in a blood vessel, the blood on the very edges of the vessel, they scrape along the vessel. This is the concept of shear. It actually slows the blood down. So this means that the blood in the very center of the vessel, it has the least amount of shear. It's not scraping the sides as much as the other parts of the vessel. So it's going to have the highest velocity. So what about a vessel that has a big, ugly plaque, like in atherosclerosis? Well, the plaque actually makes the vessel narrow and rough. So the blood scrapes along a lot more sides of the vessel and it becomes harder to push through. This is because the pressure that's generated by the heart is not being moved efficiently. So that's what I want you to understand, is that turbulent flow is not efficient. Now, let's say that we started out at 100 pressure and we have a laminar flow. We have a very nice, clean, wide open vessel. We can see that the pressure is going to be used efficiently. We might go from 100 to 50, but if we take a turbulent, if we take a very occluded vessel and we say that it's turbulent, if we have 100 pressure, we might only end up with 10 pressure. This is because the pressure is not being used efficiently. So we can see that the blood is going to be very turbulent. It's going to go all over the place. So this brings us to the concept of Reynolds number. If you have to know this, laminar flow is usually going to equate to a Reynolds number that is less than 2,000. And if you have a Reynolds number that's above 3,000, it means that the blood is likely turbulent, or another word, ineffective. So increased velocity of blood or speed or a decrease in viscosity or thickness will cause Reynolds number to go up. So an easier way to explain this is, let's think of this scenario. So if you had atherosclerosis and anemia, you would be in real trouble. The atherosclerosis, that plaque, would make your blood scrape along the sides. And your blood's going to be so thin from the anemia that the blood is going to be very turbulent. Now, the opposite of this is if you had a little bit thicker blood that was clean, you could say that you would have a very low Reynolds number. You would likely have laminar flow. Now, the last concept that we're going to talk about today is called compliance. Compliance is volume over pressure. This is a vital concept to understand if we're going to understand what the heck blood pressure even means. So compliance is how stretchy something is. Veins are very, very compliant because they can hold a lot of blood volume, that unstressed volume, without much pressure. The arteries are the exact opposite. Arteries are so thick and muscular that they can't hold much blood without having tons and tons of pressure. So they're not very stretchy. We say that they're not compliant. So for a little experiment, let's say that we inject 100 milliliters of blood into an artery. And let's say that the pressure goes up to 100 millimeters of mercury. It goes up to 100 pressure. We say that that artery is not very compliant at all. It didn't absorb that volume without generating pressure. Now let's say that we inject the vein with 100 milliliters of blood and it only goes up to 2 pressure. Well, we would say that the artery is very strict. It's not compliant. It doesn't want to expand. It has a lot of pressure. Now the veins, we could say they're very loose, they're very stretchy, they're very compliant. Veins can hold a lot of blood without pressure, while arteries can hold a little blood with a lot of pressure. So a great example of this is that when we get older, our arteries naturally get stiffer. This is called arteriosclerosis. Now, this means that our arteries, become even less compliant. So they're going to become even less stretchy. They're going to be super, super thin. They're going to be very, very tight. So even when we inject just a little bit of blood, that pressure is going to go up a lot. And this can be seen in older adults. They're going to have very high systolic blood pressures. That's because the arteries, they can't stretch to accommodate that cardiac output, so they're going to generate a lot of pressure. Now, this wraps up our lecture for today, and I hope that this big concept of hemodynamics is just a little bit more clear. But I'd like to thank you all for taking the time to learn with us today, and remember to like and subscribe for more content. Thank you.